Hello everyone. A very warm welcome to this national webinar being organized by All India Medical Service Center. This webinar is being organized on the occasion of Doctors Day Protest Week that begins from 25th June to 2nd July. We have a series of program on this occasion, and one of the programs is this webinar. But today's topic is, will corporate and insurance based system and NMC CBME, that is competency based medical education, improve the healthcare and medical education in our country? A very important topic which we are going to discuss today. And as you know, Medical Service Center is one of the voluntary social medical organizations working since decades, 1977 precisely. It has been working in areas where there are medical disaster management, then in health movement across the length and breadth of the country. Friends, today we are living in a very difficult situation. Just now, second, third pandemic of COVID is being going on. Nearly 40 lakh people have died. Many are suffering during this period. And as someone rightly said, this COVID system has exposed a broken health system. During this COVID period and aftermath, a series of changes, policy changes have been introduced by various central and state governments, which are having far-reaching effects on health field and medical education. So this is a very crucial juncture what we are witnessing today, and it is very much imperative that we have to discuss these issues and prepare health movement across the country. In this background, we are organizing this webinar for discussing threadbare different issues concerning the health system and medical education. We have a very eminent panel for this webinar, and may I introduce each one of them. A very warm welcome to Professor Mridul K. Daga sir. He is a former HOD and Professor of Medicine from MAMC, New Delhi, and a very renowned physician, advisor of MSc. Welcome to you, sir. I think audio is...
Thank you for your kind words of introduction. Namaskar.
Namaskar, sir. Namaskar. Then we have with us Dr. Sudhanshu Shekhar Senapati, who is a senior pediatrician from Odisha. Welcome to you, sir. We have with us Professor Shyam Sundar Deepte, sir, who is a Professor of Community Medicine, Government Medical College, Amritsar, Punjab. Good evening, sir, and welcome to you to this webinar.
Thank you.
We have with us one more panelist, Dr. Sajal Biswas. He is the General Secretary of Service Doctors Forum, West Bengal. I welcome Dr. Sajal Biswas to this webinar. And we have one more panelist who will join shortly, Dr. Tarun Mandal. And we may now start the webinar. And I repeat the topic, which is, will corporate and insurance-based system and NMC improve the healthcare and medical education in our country? This is the topic, a very burning topic which we need to discuss. I first invite Professor Mridul K. Daga sir to speak on the impact of the obscurantist policies, approaches being introduced by NMC in medical.
I think we lost him. So at the outset, let me thank Professor Dr. Tarun Mandal and Dr. Anshuman and everyone from MSc. And I apologize that I have not prepared any slides or anything to show you some data, but I can verbatim remember and speak about those. We have huge number of medical colleges now. And we know many of the medical colleges do not meet the standards what is needed for basic medical education. We have huge shortage of faculty. We have huge issues with infrastructure. And despite, large number of students every year appearing for NEET and wanting to become healthcare workers, healthcare professionals, we lack in quality medical education. So few features which really contribute to all this is there is lack of comprehensive user-friendly policy in our country. Medical education should be looked into holistically, not only in terms of just creating this population of medical doctors, but also making them good human beings. And so, even if there are strict yardsticks set up by National Medical Commission, there have been a lot of leverages also. But unfortunately, the administrative setup, the setup from the ministry has a lot of interference in day-to-day working. And so there is no autonomy to NMC. Having said that, even if you have autonomy, the way NMC functions needs to be relooked into. This came with a lot of halla that NMC would, be the panacea for all the shortcomings we have in medical education. But I think it is still not taken any step forwards toward that. Because we know that despite one important commitment which NMC was to do was reduction in the fee being charged by private medical colleges. Although the circular has been issued, but there is hardly any implementation on ground. So you are left with students leaving our country and going to other countries where they do a medical education in 1/5 of the cost what they will do in India. And when they come back, they again face a challenge, what we saw right now, what happened in Ukraine, which is unfortunate. But from other places, when they come back, the exam they have to give, only 30% of them clear that exam. So we need to look into why are students leaving our country and going abroad for taking their graduation in medical sciences. So NMC has to focus on this issue on top priority, make medical education more congenial in terms of people who want to run institutions. Having said that, it would not be open for all. Certain standards have to be maintained, and use of digital technology to the maximum needs to be encouraged. We may not have patient, but we have good digital platforms for training of the students. So the accountability has to be fixed, and that fixing accountability calls for real assessment of an institution. Earlier, there used to be every year inspection of medical colleges for 5 years. Now, it's been turned down to just on the beginning and after 5 years. That's a welcome suggestion, but there are many loopholes in that and lacunae in that. So, the loophole and lacunae in that can be taken care of by envisaging, by entrusting local people there, involving local people, local medical community to do the work of NMC, which can easily be done. Number two, we also need to look into what is the target, what are we looking into, what are we going to, when you have such low pass percentage of NEET, a lot of time you find students who have no interest and they are entering. And when they enter for first 5 years, except first year, all next 4 years, they are busy in coaching classes. So that system of getting into a postgraduate course through an entrance exam has to be looked into, because there is no weightage given to your graduate training marks or your grades obtained there. So we have to go back to that system, that the grades obtained in your graduation would contribute to your admission to post-graduation. So there are many more challenges, and I'm very sure the other panelists would look into that. What we need to do is regulate the medical fee, regulate the quality of medical education, and the curriculum which is competency based needs to be really implemented in toto. It's being implemented in very haphazard manner, and when we see it, a lot of institutions do not have neither the resources nor in terms of technicalities or manpower to implement those. Thank you very much.
Hello.
Yes, sir.
Yeah. Thank you so much, sir. Am I audible now?
Yeah.
Brief interruption in network.
Yeah. We can hear you.
Okay, sir. Okay.
We can hear you.
So, yeah. Thank you, sir. Thank you. I think Dr. Tarun has joined as a panelist. I welcome him on behalf of all our viewers. He is a former member of parliament and also member of a parliamentary standing committee on health and family welfare, and is also vice president of Medical Service Center West Bengal. Welcome you, sir, to this discussion. Thank you very much for joining us. So now I'll request our next speaker, Dr. Shyam Sundar Deepti, and he will be discussing about how NEP, New Educational Policy 2020, and NMC are different from earlier MCI, and what does the undermining of democratic process and making a more bureaucratic body will affect the content and ethical standards of medical education. That is one part. How is NEP, NMC compared to vis-a-vis earlier MCI version and new changes introduced? What will be the implications? And secondly, how will the so-called Indian medical knowledge that is being promoted in learning and practice of medical profession in our country is going to affect? And this is one part of the question. Secondly, how is the corporate functioning of health system and the total insurance changes, conversion, is going to impact the health outcome in our country? So he will be going to speak on these two important topics. Over to you, sir.
Thank you very much. Thanks to the National Medical Center team and all the listeners and my co-participants in the webinar. As Dr. Daga has rightly and pinpointed, highlighted the few things very importantly about the education. As I belong to the education system in Punjab, here in a medical college Amritsar, so I have gone through that aspect of education, and of course, being a person of community medicine, my main aspect that related with the community, because we take our students to the community, because as a part of subject we have to take an area in a rural area where we go and teach our students. I start with that. Mainly we are all concerned with the health of the country, health of the people, and health has two main aspects. One, I will say, that is medical education, and second is of course the health services. And two are of course distinct area, but they are two are complementary to each other, because whatever we are going to teach in the medical colleges, that we are preparing the students, ultimately they have to serve in the community. So these are two, of course, they are related. Maybe the medical education and research, and our research material comes from the community or the patient where we have to serve. So these two important aspects, they are interconnected. And I will start with the medical education. Of course, some of the aspects Dr. Daga has already highlighted. I start with that the medical education entry to the medical colleges starts with the, we say that there is a +2 medical student, they are the eligible for the undergraduate NEET examination. But one thing is very important over here to see that, of course, is a +2. After +2, the NEET examination is to be taken, but it is already, everybody knows it is that the NEET preparation that starts after in the +1, when as the classes of +1 starts, the students, they all leave the school. They are dummy students, of course, they are dummy admissions in the schools and everybody in the NEET center. And the part NEET, they have to, at least I have done a survey in the students, minimum 3 to 4 lakhs rupees they spend on the NEET preparation before giving examination for the NEET. After that, the admission in the medical colleges, and then what is the fee structure, that is another aspect. In medical colleges, after that, the NEET examination, they have to admit in the medical colleges. There are 609 medical colleges now. At present, there are 609 medical colleges. Very large number as compared to when we talk about the few years back. They are not so much in number. They are increasing in number because one survey, it was decided, and it was come out that we need 4 lakh medical doctors in our country. We are lacking 4 lakh doctors as per the population and patient with the patient doctor ratio is concerned. As per the WHO standard, we have to reach to that standard. So we need more medical colleges. So there was they allow the medical college to open, and the private people, they came into this field, and now there are 609 medical colleges. About 90,000, more than 90,000 seats are there in all these medical colleges. One aspect is, of course, out of this 265 are private, and there are about 69 there are deemed universities. Of course, they have to give their certificate, they have to take their own exams. These are the deemed university status. But of course, 265 private colleges are quite a good number. Question of private colleges comes that they are taking a huge fees, as Dr. Daga was also saying that no college is there which is taking less than 25 lakh, and that too lump sum 25 lakh in the beginning. Otherwise, it is about 40 to 50 lakh. Many medical colleges there are. But as far as the government medical colleges are concerned, if we talk about the fee structure, we talk about the hostel and the mess and other books charges, it also comes to about 15 lakh rupees, and near about in the government sector also. So 15 lakh is not a very less amount. Then they have to prepare for the NEET examination, where they are taking about 2 to 3 lakhs rupees. So it comes about 20 lakh rupees for the entry to the medical college examination, medical colleges for becoming a doctor. So that is a very important aspect, because when they are going to prepare becoming a doctor, and then of course they have to serve the community. And again, we will see that how much money one can spend during this period to become a doctor. Then we see the ratio of the students when they are coming to. They are not from the actually all the strata of the society as far as the socioeconomic status is concerned. And as far as the locality, urban and rural, that also we can see to it that they are not coming. I, as a student, I remember my days when I was a student, in 150 students in the class from every part of the Punjab, every corner, maybe urban, rural, and suburban, and maybe small towns are the students who are coming over there. But now we can see they are segregated to few, say, cities of the Punjab. As we can see, the Ludhiana, Chandigarh, Patiala, Amritsar, all these types of, and about say more than 80% they are from all these 4-5 cities, and then to again from the socioeconomic status. That is one aspect. And now second is the teachers over that medical colleges who are coming. Of course, that also issue was talked about Dr. Daga. If we see the teachers in the private in the medical colleges, there is no faculty. I will say if there is a faculty, and then we can see, I have myself some of the information that I got from private medical colleges. They are, and there is no full-time faculty. There is only 1 or 2 teachers they are on a full-time. Others are part-time, or there is dummy faculty also there is because their simple name is used in the register, but they are not visiting, of course, and then they are given some of the small amount of money for just giving their permission that you can use my name. So all these types of offers, I have a say in my WhatsApp data that these type of offers I also got from medical colleges after my retirement. Of course, I can according to that I can also serve for few years or more, because again we can see that these private medical colleges, they have got the changes in the rules and regulation in the National Medical Commission, that number of professors, they can keep number of professors less in number as compared to when Indian Medical Council, because there is one professor is sufficient, and other faculty can be a junior faculty as associate professor or the assistant professor. So these type of you can see the changes in the say faculty and the student also when they are going over there, they are also from. I used to say that there are dummy students from the dummy preparation in the +1 and +2, and then the teachers again here is the dummy. And the third aspect here is the medical education is that again everybody admitting in the undergraduate course, they know that they have to prepare for post graduation. Again, the NEET PG is again another aspect which is a stress over them, and then nobody think that they will simply MBBS, they can do MBBS and they can settle in the life. Everybody, in at least the students, they know that PG is must. Then the PG preparation starts immediately after entering into undergraduate course. So that type of stress take away from the practical aspect and the hospital duties, and they are more concerned about preparing in the undergraduates, the postgraduate PG. So this is another important aspect that they are not taking interest in. Again, the teachers also think that they are not interested in the. So two-way there's that relationship developed between the interest of the teachers and the interest of the students. So that gives a point to the say private management, because they think that they are only need only the fee whatsoever their students are paying, and they are also paying very less to the teachers because they are dummy teachers. So that type of environment we can see in the medical colleges. This is one aspect that we are seeing in the medical education. What type of medical education we are giving, and what type of doctors we are preparing with this huge amount of money, and we want that they should serve in the community. And as far as the second part, the service part is concerned, health services are concerned, we can say that government is taking hand away from the public sector in the health. Of course, we have seen in the COVID period that all that what the scenario we have seen in our public health sector and even in the private health sector, but only the corporate they are coming and they are barely having a concern over that they want to earn the money again. The cycle of education, maybe cycle of the services, all that is now centered around that money, and this is another aspect. And you can see in our national health policy that is to decide what they have to serve, how they have to serve the community and the community. So again, in the first paragraph in the national health policy of 2017, this is the third draft after the national health policy, which was first prepared in 1983, and after that the first amendment was done in the second national health policy in the 2002, when the privatization was introduced in our country, and the health insurance, they were also introduced in the second health policy. And now we can say that in the first paragraph of 2017 policy, there is a word health industry. So they have declared the health as an industry. And when we are talking about the health as an industry, it means that it is going in the hand of the corporate sector. So in the corporate sector, we can see the chain of hospitals, they are coming in our country, maybe a Fortis, maybe a Apollo, maybe a Max. All these type of hospitals, they are coming in a very large number in the various cities in the whole of the country, and I can talk about in the Punjab also. So what is their requirement? What their requirement is a super specialty. They are simply maybe knee replacement, maybe a stunt, or maybe a heart problem, or maybe a brain tumor. All these types of these type of patient, they for emergency, or just the patient enter into the into their hospital, they require a simple, just first aid care, and then the simple MBBS or maybe even Ayush and all those the people they are coming. So the rural aspect, this is I belong to community medicine, and the rural aspect that is a highly that is being affected by this type of preparing the doctor. They are not ready to go to the rural community, rural area, because they have their first they are coming from the cities, and they are coming from the families from where they are of the upper status families, and they are not interested to go to the rural area, not to serve in the rural area. And we have no regulation that after passing the course of MBBS, they have to serve for 4 or 5 years before they appear for the NEET PG or to do their post graduation. So there is so far that they have not make that compulsory regulations for those students, but they have an alternative that they are a community service officer. They have been CSOs. They have 6 months say training to the BSc nursing, or maybe a BAMS Ayurvedic, or maybe even a dental doctor. They can also take this 6 month course, and they have to serve over there in the rural community in charge of the, which they have now changed with the sub-study health center to the wellness center. So all these we can say that as far as the medical education is concerned, that is highly affected by this type of corporatization of the new medical colleges, and they are changing or getting their rules changed from the National Medical Commission. Rightly said Dr. Daga that previously by medical MCI, they were having regular inspection of the medical colleges, but now there is only first time only inspection, and after that there is accreditation. There is no inspection in even that there is accreditation, that every medical college has to take the accreditation from the private companies, and then they A plus, A plus plus, A plus plus. And they say that this is now the choice of the students. They have put this portion on that the students, they have to take the responsibility. They have to see whether they have to go to which medical college, which is having A plus or A plus plus, how they are going to advertise all that. So, but again, I told you that this may be A plus or maybe A plus plus, but ultimately, when they enter into the undergraduate MBBS course, they are not concerned about MBBS. They are concerned about at the same time the post graduation. So the post graduation is in their mind, and while going to the classes of anatomy, physiology, or first year the MBBS graduation course, what they are mainly going to the DAMS classes, or for the preparation of the NEET preparation. Again, there is a sometimes they manage to go not to go in the medical colleges in the classes, and then they are taking the classes on the for the postgraduate NEET PG. So that is the scenario of even overall. So all that, as I told you in the beginning, that we are having concern with the medical education and the health services. They are two separate, of course, the department of the health, but they are interconnected, complementary to each other. How we are going to prepare our medical graduate, those who have to serve in the community, and what the services, how the commitment of the government is there, that we see that every time, every year, the health budget is reduced, and we are thrown on the say apology of the corporate sector, who is taking a huge amount of money in the form of treatment. So in this scenario, we can see that as a National Medical Center, we as a doctor, which of course feel concerned with that, all these issues should be taken into consideration, and we should prepare our own some alternative policy, as a few points Dr. Daga has also highlighted. So we should prepare our own that how our graduate, they should be prepared, and how that the postgraduate, and there should be gap between the post graduation. We should know that how much postgraduates we need, and how much postgraduates in which specialty we need. So all that type, and the burden on the undergraduate, that they should be a free time for them that to learn the. I think that our preparation for the undergraduate, if this competency based is there, of course this is a welcome step that they are becoming competent, but ultimately we have to see the after graduation how much competent they are. I think till date, of course, this new program has started just 2 years back, but I can see that the students being admitted in the undergraduate course after 5 years, even after internship, many of they are not even able to get a skill of doing the intramuscular injection. What to talk about the intravenous injection? So these are the practically that we have seen over here in the when the because they all are interested in preparation in the so all that scenario we should take it to consideration, and after that I think we have a conclusion with what type of medical education and what type of health services we need in our country, because we know the socioeconomic status of the country and that the demography of the country also. Thank you very much.
Thank you, sir. Actually, you covered the infrastructure part, how medical colleges after NMC, what are the inadequacies, and how medical colleges are allowed to run despite lack of infrastructure or teacher-student ratio, and consequences of coaching, fast-paced learning, entrance-based education. All those things you have covered very nicely, sir. Thank you very much for this wonderful presentation. Now, I will move on to our next speaker, Dr. Sajal Biswas. He is a secretary of Service Doctors Forum, who has organized several movements in for service doctors. He will speak on the outcome of general bureaucratic conversion of health system, basically administration not by doctors but by administrators. So what is the outcome of this bureaucratic approach? And also we will touch upon the compulsory insurance in government sector. So these two topics he will speak. Over to you, Dr. Sajal Biswas.
Thank you, Dr. Bhashu, and organizer of Medical Service Center, Professor Daga and Professor Shyamsundar Dipti nicely said about your previous topics. I would like to speak something about your question. It is a very big problem in our health system, administrative terrorism and shifting of administrative axis from technocrats to bureaucrats. It is the present phenomenon. We recollect the thing in mid-18th century, Ishwar Chandra Vidyasagar in our country, a great humanist and pioneer of the Renaissance movement, once he refused to take charges of principal of Kolkata Medical College, as he thought this is a highly specialized field and highly specialized persons will be look after this section and take these charges. And in mid of the 20th century, we saw the board committee, a historic committee on the health in British India. Recommendation of its reflect the similar things. A highly specialized person, highly skilled doctors will look after the administration of health system, and this was also reflected in our freedom movement and freedom fighters' aspiration. It was there. If we see the health system and health management of different countries in the world, I saw during the changes of health system, management of the health administration also be changed. For very beginning of socialization of health system in Soviet Russia rather than USSR, where socialized medicine was socialized and side by side there was established administration by the technocrats, the highly skilled persons are in administration there. And some countries, highly developed countries, capitalist countries like Britain also, this system also there. But during the changes of the health system, this has been changed, and at present we see the administrative fulcrum has been changed from technocrat to the bureaucrat. In very beginning in our country, doctors are not brought in administrative responsibilities in all over the country. The historic movement organized by Health Service Association and FETO, the rule of giving health administration responsibility to physicians was established in compliance with the demands of the movement. Although our government, Indian government, has never created IMS cadre, Indian Medical Service cadre in our country like IAS, IFS and IPS. Though a few years back in our state West Bengal, the cadre like West Bengal Public Health and Administrative Service has been created, but due to lack of attention and due to lack of infrastructure, due to lack of supportive staffs, due to lack of other facilities, these cadres has stumbled from its very beginning, which is currently on the verge of extinction. It is our deep concern that by the way of changes of health system, health administration has been changed. In our country, in 2002, adopted second national health policy, where floodgate of the commercialization has been opened, followed by government taken on project like National Rural Health Mission and created a policy like public-private partnership. Through NRHM, now it is renamed by NHM, most of the responsibilities of the health department has been handed over to an NGO called Health and Family Welfare Samiti. On the other hand, through public-private partnership, government provide most of the diagnostic and medicines like CT scans, MRIs, and medicine shops like Fairprice shop and Janaushadhi Prokolpo. At this time, the power of management passed into the hands of the business houses of those institutions. Through the NRHM, greater part of the responsibility for management goes to the Health and Family Welfare Samiti, headed by IAS and bureaucrats and political leaders. And since that time, most of the funds of the health department has been handed over to the Samiti head. As a result, from this time onwards, doctors and health administrators are forced to face the bureaucratic officials of the Samiti. As a result, the health administration became virtually under the control of this Samiti, like bureaucrats, political leaders, and businessmen. Obviously, its impacts is felt directly on the health services. Administration becomes mechanical, inert, and also autocratic in nature. The health department is now ripe with theft and corruption. The people's health services need a gradually synced, lack of scientific basis of planning and unnecessary political interference tend to waste a lot of money on building which was less necessary or unnecessary infrastructure. When the medical administrator or doctors oppose these states, they fell into the anger of the bureaucrats and general administration and ruling parties. For a long time under pressure, many doctors forced to quit their jobs, and many doctors are victimized of immoral transfer and suspension. Many physician administration and physicians are victims of the administrative terrorism also. And side by side, some medical administrators unable to cope with the pressure of this situation, or in lieu of good opportunities and good posting and good position, get themselves involved in the unethical acts of this bureaucratic cycle. Despite being doctors, at one time some of them become corrupt like bureaucrats. And on the occasion of government, through them implemented all types of anti-people health policies in government sectors. As a result, anti-people health policies continues and enhanced it. Health has become more and more expensive commodities. People lost their rights of health. It is not the world. The remnants of this are still being destroyed today through the third national health policies, which was taken in 2017 by the name of universal health coverage. Ayushman Bharat health card is the basis of these policies. For this, a unique ID will be created for each and every citizen, which is virtually nothing but an insurance-based healthcare system. In order to completely deprive the people of their right to health, the government is rapidly removing doctors from the health administration and replacing bureaucrats in all parts of health system now. On the other hand, general administration is being empowered at every level to turn the stick over the doctors. As an autocratic, unnecessary work is getting priority over the very essential works. Even doctors, nurses, and health workers have to work behind unnecessary work continuously through day and nights. As a result, health services are gradually synced, and instability and restless environment is being created in the workplace. Even though everyone is working day and night, there is no solution for the service of the people. People are being deprived of more and more services day by day. So, administrative terrorism today is not just putting pressure on doctors. This situation is completely taking away health from the people. So, we should protest it, and we have to move against it. Now let's talk about insurance-based healthcare system. In many Western countries, including USA, Britain, and France, etc., where insurance-based healthcare system have been developed for a long time. In most of the cases, there is corporate insurance. Social insurance has been introduced in Canada and some other countries. However, social insurance are also practically run by controlled by the corporate insurance partners, corporate insurance companies. And how much harassment people have to get to get treatment from all this insurance dependent healthcare system, it is very well known today. In very recently, during COVID outbreak, over the last 2 years, has shown how people in those countries like in USA, France, as well as Britain also, have died on the street without getting any treatment, without getting hospital beds, without any oxygen. Almost all of them had some types of insurance card. On hand, the government has no direct responsibility in the insurance dependent health system. On the other hand, corporate insurance companies took premium money but did not take responsibility of the patient, moribund patients. However, in countries where the national health care system is still in operation, such as in Cuba, the COVID attack and death from COVID rate are very low is there. In our country at present, around 10% of population are covered by corporate insurance coverage, and more than 70 to 80% people in our country are highly dependent on the government run health system, health services. The government is making the entire health care system into insurance based health system through universal health coverage. It has been adopted in the third National Health Policy 2017. The process of which has started through Ayushman Bharat Bima Yojana. In the name of digital health, every citizen of India will be given an unique ID, which is actually part of an overall insurance system. In this insurance-based system, a family will get cashless benefit up to 5 lakhs per year. How much would we have been available from our national health system? People used to get completely free medical treatment for so long. There was no upper limit. In the case of West Bengal, there is separate insurance card called Shastro Sati Health Card, which is similar to the Ayushman Bharat Health Card. Total coverage up to 5 lakhs per family per year, but it is separate card introduced in our state. Though government of West Bengal announced in 2011 all treatment of the government sector would be free, but why this insurance card? Why the upper limit of treatment is 5 lakh rupees per family? In fact, with the introduction of this card, the government has obstructed the medical treatment of the people by entangling them in the net of the insurance. Just as people are not getting treatment without a card at a particular moment, people are also being harassed for getting treatment to fulfill the various criteria of the insurance, even if they have card. From where is the government getting the cost of the health insurance premium? Is government allocation will high and separate separate budget is there? No, there is no separate budget. The government is deducting money from the existing budget and paying the insurance companies dues. At present in West Bengal, per day 10 crore rupees are expended for this purpose. So how much is about for the year? 3,650 crore rupees per year, which is almost equal to the entire central health budget, and it is equal to the total budget of the West Bengal government. So how will this project will work? Where will money will come from? It has no answer. And this is the reason why the private sector health partner or Ayushman Bharat Bima project is stumbling in the middle. People's treatment is getting stuck in the middle of the road, as the health partner has been made compulsory in the government hospital in the West Bengal. On the other hand, the small amount of money allocated to the health sector, which is less than 1% of GDP, and which used to be used directly for the hospital services, is now being siphoned off into the pocket of insurance companies, insurance owners. Insurance companies are booming. People are losing their right to health. So, insurance-based health system is not the solution in our country. And before 80 years ago, Dr. Norman Bethune, a great internationalist cardiothoracic surgeon and pioneer of people's health movement, once said, insurance is a bastard form of nationalization of health. Today's people are realized what are the insurance-based health system. So we have to fight, and we have to build up all-out movement against it. Thank you all.
Thank you, Dr. Sajal Biswas. It was a good discussion, good presentation on both aspects. One, the result of administration, bureaucratic approach to administration, and gradually doctors being removed from administrative aspects of health. And secondly, you talked very in detail about the difference between universal health coverage, which is based on rights approach, health being a fundamental right. And now what is being brought in is universal health insurance. And you have in detail explained the difference between the two, compared with several countries, and ended your talk with the quote by Dr. Norman Bethune, who is an international fighter for health rights. With this, I thank you for your talk. And now I request Dr. Sudhanshu Shekhar Senapati. Actually, the question which I asked to Dr. Shamsundar Deepti should have been gone to Dr. Sudhanshu. I apologize for the mistake. I request Dr. Senapati sir to speak on the NEP, New Educational Policy 2020, NEP 2020, and NMC, and how is it different from MCI, and how MCI is different from the bureaucratic body that is now, that is NMC, and also what is its bearing on ethical aspects, ethical standards of medical education. Then what is this talk, increasing talk about Indian medical system, Indian knowledge system that is being promoted in learning and practice of medicine in our country. So I request you to speak on all these issues.
Can you see my slides? Yes, thank you. It's a pleasure to speak on the forum of Medical Service Center. Thank you all for organizing such a webinar and giving me a chance to present. Can you see my slides? Hello? Can you see my slides?
Yes, sir.
Yes.
Yes. Now it's very clear.
Yeah. We all know during the COVID pandemic what the state of our healthcare system was. It almost collapsed. No beds, no oxygen, no ambulance, no medicines. So it is highly important for us to look at our healthcare system. Somebody has rightly said the pandemic was a mirror to our healthcare system. Let us see what is our healthcare system at present. Can you see the second slide, sir? Hello?
Yes, sir. Please go on.
Yes,
Streets are very vast. Yes, sir. Visible.
Yeah. Our healthcare system has two parts: medical education and health system. I will talk on 3 points: the National Education Policy 2020 and medical education, the NMC Act 2019, and privatization of health sector and insurance. My previous speakers have already spoken about the commercialization of medical education. We have about 286 government medical colleges and 276 private medical colleges in India. The total seats in the medical college is about 1 lakh. The candidates for NET is 16.1 lakhs. So the ratio is 1:16. Out of 16, only one gets the seat. And NET is too competitive. So students have to start preparing for it from class 8th. And the questions are so prepared that is not related to the textbook. So they have to go for coaching. And we all know the coaching business that is going on in India, starting from the quota to all the states and the metropolis. The cost of medical education in India, already our previous speakers have covered this. In government colleges, it is 2 lakhs to 4 lakhs per year. Private colleges, it is 9 lakhs to 25 lakhs per year. And the total duration is 4.5 years, plus hostel fees, food, books, instruments. For a simple MBBS in a private college, it comes to about 1 crore. And postgraduate, it is around 2 to 3 crores. This capitation fee has been legalized by the governments, previous governments also. So students are now going to other countries, foreign countries, to do the MBBS. A 4-year course in Ukraine costs 15 to 16 lakhs. About 2,000 medical students were there before the war. Medical education is cheaper in Russia, China, Philippines, Germany. Medical education in Cuba is free. Let's see what the NEP 2020, which was introduced on July 30th of 2020, when we were in the middle of the pandemic. The first wave was there. What does it say about the commercialization of education? The first two sentences you will see. It says that combat and stop commercialization of higher education. Again, it says education is a public service. Access to quality education must be considered a basic right of every child. But if you go down and go to the other clauses, we see that it encourages true private and community participation in education. And it also says fixing the fees with upper limit. What is that? Fixing of the tuition fees in the private medical colleges, private educational institutes to an upper limit, so that the individual institutes are not affected. The private institutes are not affected. So the NEP 2020 has two contradictory statements. If you go through the NEP 2020, one thing it comes with, engaging course in Indian knowledge system. Further, it says, knowledge of India will include knowledge from ancient India. Indian knowledge system, including tribal knowledge and indigenous ways of learning, including medicine. Specific courses in tribal ethno-medical practices. What is this? Tribal ethno-medical practice is something very crude medical practice. It is a trial and error method which was going there. Is it scientific? What would you learn from the tribal ethno-medical practices? Let us see what is Indian knowledge system and knowledge of India and knowledge from ancient India that they profess. What is knowledge of India after all? Knowledge is knowledge. Truth is truth. Is truth bound by a national boundary? We say, again further, if we look at the inventions of the world, whether it is Einstein or Newton or Copernicus, do they belong to a country? Are their theories bound by any countries? No. It is the knowledge of the world. It is the struggle of the human population that has given this knowledge. Knowledge of India is a misnomer. To bound a knowledge within a country is a misnomer. Indian knowledge system. What do they mean by the Indian knowledge system? They say that it is the knowledge from ancient India. So, if we consider the case of medical science, what is the knowledge of ancient India? Was it scientific? What is the method they used? They used a method of trial and errors. Science has developed a lot since then. We are in the 21st century, and we are talking of the knowledge from the ancient India, or knowledge from ancient Greece, or ancient Rome. Is that applicable to now? We are talking that we will be the Vishwagurus, the leaders of the world in knowledge. But we are going back to the ancient India. Yes, the knowledge, medical knowledge in the ancient India was at its highest state when in the world at that time. But at present, if we compare the knowledge of the present time to that of the ancient India, we will be going we will be taking a regressive state, not a progressive state. In the name of knowledge of India, what they want to profess is quackery, an unscientific practice, and the healthcare will be a victim of it. Again, in case of the medical education, they say in NEP 2020, 20.5, that all students of allopathic medical education must have a basic understanding of Ayush and vice versa. Already the students are burdened with a 5-year course, MBBS. They have to study so many things. Again, a basic understanding of these things, how it will help. It will be only a mixopathy or a crosspathy, which will not help. Neither it will help the allopathic medicine, nor it will help the Ayurvedic or Unani or Siddha medicines. One point they say here is healthcare system must be integrated. This is a welcome step, but what do they mean by integration? Integration of traditional medicine and modern medicine is also on the agenda of WHO. But what WHO does is evidence-based integration. WHO done with the Chinese government. They have done it. Chinese traditional medicine has been integrated only on some aspect. Whatever traditional medicine is there, we have to do a research on it to find out the safety, effectiveness, drug interaction, and the dose of the dose, so that we can use it now. And WHO with Chinese government has produced 2 books on evidence-based medicine on COPD and psoriasis. Even for acupuncture, they have done evidence-based research so that the needles are specified, where the needles will be used, what points will be used, how long they will be used. Everything has been categorized. That is called integration. Now next, the NMC Act, which came in 2019. The National Medical Council Act, they scrapped the previous body, the MCI, Medical Council of India. The argument was that the Medical Council of India was a corrupted body. Yes, it was corrupted. But what should have been the role of the government to make it transparent? But instead of that, they scrapped the MCI and introduced the NMC. NMC is an autocratic body. Why do we say that? The total numbers are 33 members in NMC. Only 25 are selected. So 25 are selected by the government. Only 8 are elected. So only 20% of the members are elected. Whereas in MCI, out of the 100 members, 70 were elected, 30 were nominated. And the chairman of the NMC is also selected by the government, central government. There are some provisions in this NMC Act which are very dangerous, which shows the autocratic nature and the centralization of power in the hands of the central government. It says the central government may supersede the NMC for 6 months. Again, it says it empowers the central government with draconian powers. Section 45(2) of the NMC Act says, decision of the central government, whether a question of policy or not, shall be final. Any decision taken by the NMC, whether it is final or not, it will be decided by the central government, not the NMC, National Medical Council. Again, Section 55, power of the central government to supplant, means to override. If NMC takes a decision, the central government has the power to override it. This is, again, Section 46, all powers on the central government. State government will only comply. This is, once again, an attack on the federal structure of the nation. Then the bureaucratic high-handedness. There are 3 members in the NMC who are appointed by the government, and they are cabinet secretary to the Ministry of Health, additional secretary. Again, the NMC came with the purpose that MCI was corrupted. But we will see how NMC is also going to be corrupted as time goes on. It says that access to quality and affordable medical education. But in Section 10A, it says, to frame guidelines for the determination of fees of 50% of the seats in private medical institutions and deemed to be universities which are governed under the provisions of the Act. Means 50% of the seats in private medical colleges, the tuition fees will be fixed by the NMC. So how it will be affordable to the common people? The fees will remain high, and 50% of the seats will be free for the institution to decide what will be the fees. Somebody has said there has never been a blatant pro-rich bias of this intensity. The NMC bill is pro-private management bill, paving the way for widespread corruption. Next, the NMC came up with a new idea. The next examination, which will be the final year examination, instead of the MBBS final examination, they will introduce a new examination, which is called the next, which will be centrally controlled. There is no clear guideline how this will be held. And what about the clinical examination? What will be the type of the question? It will be long questions or multiple choice. Again, this next will encourage the coaching centers. Again, the coaching centers will have their business. And the diploma which we had previously are going to be discontinued. The future of our profession is at stake with the NMC. Once again, in Section 32 of the NMC Act, they advocate bridge course. The name given to is community health providers. They will be granted limited license to practice. Who will be these people? Either Ayush doctors or nurses. When there was opposition by the IMA, they stopped the bridge course for the Ayush doctors. Now in Orissa, I know, the nurses are being given 3 months training and the sent as community health provider or officers. And they will be dispensing 105 medicines. And the argument given for it is that the doctor-patient relations, the proportion is less in India, which should be, as per the WHO guidelines, 1:1,000, but it is not there. That's why we want more community health providers. That is the argument given by them. These are the data from the government itself. If we, how quackery is going on in our country, 23.3% of all the people who practice medicine, this includes all Ayush medical officers, plus Ayush practicing medicine, Ayush medicine, allopathy, pharmacists, nurses, only 23.3% had medical qualification. And if you go to the nurses with medical qualification or medical degree is only 9.9%. Means 90% of the nurses that are, those who are employed do not have a degree, do not have any certificate. And the same is the case with the pharmacist. 8.3 pharmacists only have a degree. In case of allopathic doctors, it is 42.7%. That means around 57% of allopathic those who are practicing allopathic medicine do not have a degree. This is the condition of our country. Quackery is prevalent, and they are going to, NMC is going to legalize quackery by doing community health providers, giving license to them. And recent controversies of NMC. A.C. Patil Memorial College in Maharashtra, its recognition was withdrawn. A sudden visit by the NMC and recognition withdrawn. Where will the students go? Already they have got admission. If you want to, if the accreditation has to be given, why didn't you do that previously? Why didn't you inspect it properly previously? Then, once again, there is a controversy on the course on research methodology. In post-graduation, they have introduced a new thing called research methodology, but the course will not be provided in the institutes, in the universities, but it will be provided only online through SWAYAM. And that became a difficult thing for doctors to do. And there was a controversy and they had to withdraw it. And they said that now you can do research methodology at any time afterwards, after the PG. Even now, after this, all these things, there are many supercilious seats, even after the PG entrance examination, NET PG. About 1,400 seats are lying vacant. One more important thing, MCI previously was uploading on its website the report on the medical colleges, all the medical colleges, private and government colleges, assessment report, that is called the assessment report of medical college. But NMC is not uploading the assessment report of medical college. From the assessment report, a student can know what is the status of the medical college, how many, what is the faculty strength, what is the bed strength, what are the facilities available. But NMC is not uploading this assessment of report of medical colleges. This is the DSO demanding scrapping of the NMC bill. IMA had a big strike throughout the country, scrapping for the NMC bill. Now coming to the corporate healthcare, the privatization of the healthcare of the hospitals. This started in 1983 when the government decided to, the previous governments decided to promoted the private sector for curative medicine. The first hospital of Apollo started in 1983. In 1990, the insurance sector was opened to the corporate healthcare, to the health sector. In 1998, all the private players formed an association called the Indian Healthcare Federation. From 1999 to 2005, the World Bank started promoting these structures, this PPP model of healthcare in all the countries of the world. The most affected are the low-income countries and the middle-income countries like India. In 2000, the government gave permission for 100% FDI in healthcare. The data shows that by 2022, the FDI investment in corporate healthcare is around $132 billion. What was the earlier model in our country? We had government hospitals, doctor-owner facilities, small hospitals, clinics, but slowly we are going up to the corporate hospital, new setup. And low-budget private nursing homes is slowly becoming a dying phenomena because of many reasons. Because of regulatory requirements, because of the facilities, the aspiration of patients are increasing. Again, the insurance companies have come up. The insurances do not cover these small facilities, the doctor-owner facilities, or the small nursing homes. They either tie up with the corporates or they close down their nursing homes. This privatization of healthcare and insurance, both the diagnostic centers and corporate hospitals are promoted to come into this field. Less importance is given to the public health system. Health has become a commodity which can be purchased in the market, and insurance has played a role in it. What we have seen in the pandemic and natural calamities. During the pandemic and natural calamities, which sector comes into play? It is the public health sector which comes into play. The private sector is always after profit. They are all models of business models. And secondly, government is running away from its responsibility to provide affordable and quality healthcare to its citizens. And on the other hand, it is legalizing quackery and creating a space for corporate health to exploit people. Who are the stakeholders in this corporate hospitals or private hospitals? One is the owners of the corporate hospitals, insurance. Government is responsible for the public health sector, but these owners of corporate hospital, what is their motive? It's a business model. Their motive is profit. They are promoted by the World Bank, International Monetary Fund. So they do not care for the benefits to the patients. Now, how do the patients suffer? The inflated cost. The cost is very high here. And what is the quality of treatment they get? The unethical practice in the private or corporate is known to everybody. How do the professionals or the doctors, how everything has changed for the doctors? they lose their autonomy. In private, in small hospitals, in small nursing homes, doctors owners, small nursing homes or clinics, they had autonomy. But once they become an employee of these corporate hospitals, they lose their autonomy. There is a change in the employment relationship. We all know about the performance targets. These corporate hospitals, every month, they have a performance target for each doctor. So that if somebody is employed there, suppose I am employed there, they will give me a target that you give me a revenue of 5 lakhs per month. Then my target becomes to give a revenue of 5 lakhs. So how do I give that revenue? I take recourse to unethical practices, and the doctor-patient relationship is gone. There is no trust between doctor and patient, and that leads to violence. There is a paper in BMG Global Health in February 20. The impacts of corporatization of healthcare on medical practice and professionals. The unethical practices are increasing. Over-testing, for a diagnosis, they go on doing all type of tests, all diagnostic tests. They do not think what is required, what is not required, because the revenue is important. The patient's well-being is not very important. Over-treatment, medicines and admission to the ICU for small ailments. Also, they admit to the ICU. Rampant surgery. We know hysterectomies, how hysterectomies are surgery is done. Then the inflated bills, case for referral. If somebody refers a patient to this hospital, he gets a referral fees. This is the. Then they give performance target for doctors. So these are the statements from that article. Doctors are pawns in corporate hospitals. They are supposed to be conduits to earn money. They are the pathway to earn money for the corporate hospitals. Doctors become faceless, impersonalized, and less accountable in a corporate setup. They involve a lot of unnecessary investigation and lot of treatment modalities. And the whole aim is to keep the management happy. How the management will be happy? Give more revenue. How to give more revenue? By doing more tests, by doing more surgery, whether it is required or not, whether it is indicated or not, that becomes not of importance. Somebody has said that these hospitals are patient factories. This is a medical industrial complex. The relation between a doctor and patient in previously was a paternalistic relation. That relation changes to a consumer relationship in the private hospitals. So now, as conscious citizens, as part of the healthcare system, how can we save this healthcare system? The first point is scrap the National Education Policy 2020, make medical education free, stop privatization of medical education and healthcare, scrap NMC, increase the health budget, strengthen the public health system. Health and education should be a right of every citizen. This is a statement from Salvador Allende, who was the president of Chile, was a doctor also. He is considered to be one of the pioneers in public health. He says, only an organized and conscious people can bring about a different kind of society. If we want to change the society, only an organized and conscious people can do that. Another statement from Dr. Rudolf Virchow, the founder or the first public health specialist. He says, doctors should act as advocates for the poor. With this, I'm concluding my talk. Thank you all.
Thank you, sir, Dr. Sudhanshu Shekhar Senapati, sir. It was a very inspiring talk. It included a lot of information, facts, and figures, and you have spoken with evidence. So, I have spoken about the NEP and its implications, the so-called new education, national education, the so-called Indian knowledge system. You rightly said knowledge doesn't have any boundaries. And you have ended with two beautiful and inspiring quotes from pioneers. And we wholeheartedly thank you for your wonderful presentation.
Thank you. Thank you.
Yes, so far we have had a very good discussion on all the important topics. Now I request Dr. Tarun Mandal, who is a former member of parliament and also a senior vice president of Medical Service Center, West Bengal. He will be speaking on the ethical outcomes of state-run and autonomous medical health and medical education versus the corporate insurance-based bureaucratic-driven healthcare system. The two healthcare systems. What are the ethical outcomes on these two? So he'll be speaking. He will be dealing with this issue. Over to you, sir. Dr. Taramandal is online. I think he will join. In the meantime, if any of the panelists have to add any points on this important. Yes, he has joined now. Welcome, Dr. Tarun Mandal, sir.
We are in the show. Everyone can see and hear you. Hello.
Hello, sir. Good evening.
Can you hear me?
Yes.
Now, please repeat because due to lack of some connection, I have heard up to last of Dr. Senapati, and after that I was disconnected. So, Dr. Basudendra, please tell what you actually advise to do or to say.
Yes. I'll repeat once again. Till now, Dr. Senapati spoke very wonderfully. Now, I am asking you to speak on ethical outcomes of state-run autonomous health and medical education versus corporate insurance-based bureaucratic-driven health system. What are the ethical, how different are the two outcomes with respect to medical ethics? And if some of with your experience in parliament, please go on, sir.
I entered from a different phone, so it is written in Dr. Mohua. And anyway, I have told them. So, thank you to the organizers of Medical Service Center for organizing such a webinar on the eve of Doctor's Day that is scheduled on 1st of July. But the organization Medical Service Center has declared it to observe week-wise throughout the length and breadth of the country wherever it is possible. I am audible, Dr. Basudendra?
Yes,
you can hear me well?
Yes, very clear.
Fine. Thank you. Actually, this Doctor's Day, as far as the things are concerned, is declared, and it was the doctor's demand that in the society, the role the doctors plays down the years, it should be recognized. And in India, from few organizations, this demand was placed that to regard the doctors, to honor them, their service for the people, for the public health of the country, and to propel medical science for the society and civilizations, to regards and respect their role, this day is declared. But as I consider today, the role played by most of our colleagues, maybe seniors and juniors, barring few, most are not in a place to deliver the role of a physician or a doctor as a whole, for which we should be regarded, be respected by the society in general. Already it has been uttered by Dr. Sudhanshu Sanapati that we are being mostly used as pawns in the hands of the either of the corporates or of the governments to rather deprive our people from their right of health service and even of the right of the health personnel, including the doctors. What should be ideal to be endowed by the government or corporate to them. I have also listened to Professor Shamsundar Dipti and Professor Madhul Daga. They are two vastly experienced and ethical, moral, social physicians and veteran medical teachers, and they did not require any preparation to deliver on such topics what Medical Service Center has kept today for discussion in this webinar. What they speak, they say from their rich experience, their involvement with the system, and their strong will to deliver not only medical educations, but public health service for our people. What they speak, what they say, even on extempore, these are great lessons and valuable teachings for the entire medical community, I believe. Dr. Sajal Vishwas and Dr. Sudhanshu Sanapati has also very categorically, and Dr. Sanapati with his slides presentation has shown to the viewers today how the government is viewing entire health system, medical education system, its control by an MC-like body, and the future and fate of public health. Will corporate and insurance-based system and NMC improve healthcare and medical education in this country is the topic today. In a single phrase, a single term, I can strongly say this will not improve. This will destroy. This will diminish the standard and deprive our people from the right of health, which should be the fundamental right of every citizen of any civilized country. Enough has been explained and detailed before you. by our previous speakers. Medical education, particularly in private sector, has become a total unethical business to produce some degree holders of medical educations with some technical know-how and I can say some sketchy knowledges of the medical science or subject, but totally surrendering their human feelings, human touch, and social responsibility for their patients and for the community. The entire corporate sector which have entered in this public health service, including medical education and training, and not only medical education means MBBS or Ayush system, the other parts of health education has also been engulfed by this corporate sector today. And as they are being championed by each and every government, this present regime, the earlier regime, and even the state governments, because health is a concurrent subject as per our constitutions, and it has got dual responsibility of the state and the center. They are destroying good medical colleges, which were prides of the nation, which were built up with the labors, with the pains, with the endeavor, and with the struggles of many of our pioneers, medical teachers, who are called as doyens of Indian medical system, who nurtured, who created. And as Dr. Sajal Mishra said, by the Sir Joseph Hoare Committee, just before the independence, was the recommended for the entire policy as a whole to be followed by any state, any government, any state. That was written there. And our medical doyens tried to actually follow those things before even the recommendations were made by the Hoare Committee, with the fervor of the freedom movement, with the long cherished demands of the people of our country, even during that time of pre-independence period, British Indian period. So if you go into strict examination system, pass-fail system, be strict in disciplines, then you will get less students. The students who are investing so much money for a private institutions, getting less numbers in the NEET or any other qualifying examinations whatsoever. They will want such institutions where pass is more or less sure. Ensure if I get entered with such amounts of money, so nobody is there to stop me from getting the degree, maybe it's undergraduate or postgraduate. And discipline and medical ethics, inculcation of social responsibility can never be conducted there, never be taught there, because business is their priority. And for that reason, you know, before NMC started, even during that time of Medical Council of India's existence, lowering of standards of medical education, entering of more students into each medical college without increasing or enriching adequate infrastructure, it was started, which have been actually flooded by the rules and regulations introduced by NMC, National Medical Commissions, to give facilities and to give enter more business houses, more capitalists more moneyed people, corporate sectors into this medical education business. So business and ethics cannot run side by side. One will kill another. The relation is vice versa. If business increases, there will be death, there will be diminution of medical ethics, social responsibility. And that is being happening nowadays through medical education. And the most fatal blunt, I should say, blunt of attack is to introduce this Indian knowledge system in the name of national glory, what adequately has been explained by Dr. Senapati and before uttered by both Dr. Dipti, Professor Dipti and Professor Madhul Daga. Modern medical system, modern medical treatment, medical practice is based on totally scientific outlook. There cannot be any prejudice, superstition, obscurantism. The fight of our pioneers were against such social curse. And as a product of Renaissance, it was to fight all kinds of superstitions, mystic things, magic things, etc., and to establish medical science as a part of evidence-based, science-based, and instruments to give health to our people, to protect the health of our people. There, the attack of this NMC, or you can say, of this present governmental policies, are most fatal and destructive. Actually, they are turning back the wheel. Again, that plastic surgery in the name of Lord Ganesh's head, genetic engineering in Gandhari's sons and daughters, internet in Kurukshetra's war to take cow urine or to apply cow dung or to take a dip in the holy Ganges to fight COVID and so many diseases, to apply Patanjali medicines and to certify that even by the DCGI. All are very conspiratorial and very rather planned attack on the science itself. As in the general educations, they are cutting down the very essence of scientific thoughts, logics, and the basis of man-making, character building. In such a way, they are trying to again dehumanize and taking out the essence of science out of it to make it a blind thought process and to follow in the name of national glory whatever the present regime or the any power that will come later on, to follow them and to destroy medical science totally. And in public health also, they are trying to apply such cases in research also. In AIIMS, New Delhi, in such a premier institutions of the country, the ICMR have given project with other institutions to find out what is beneficial and what is effective for human health, researching out from cow urine or cow dung, such kinds of things. In medical education, they have entered yoga. We know all parts of yoga is not bad, and already modern medical science have already taken it in physical medicines, in different kinds of exercises we give to our patients, to our people, to promote and protect of their health. But in the name of yoga, in the name of past glory, in the name of tribal medicines, they are trying to bring non-science, anti-science into medical science again. Here we have to be very conscious and to fight tooth and nail that a physician is not only a healthcare giver, but he is a social scientist. He is a person who propels civilizations forward, not backward. Our predecessors were burned alive. Our predecessors have lost their lives, lost countries, lost their institutions to preach science, to establish medical science, or to read today, or to practice today. So if from there we got the medical ethics, we got the teachings of social responsibility. And if that very cord is disconnected, then essence of medical science is gone. We cannot proceed further. And that kinds of blind faith they are wanting to bring in medical education. That is the basic tenets, you can say, what has been entangled in corporatizations of medical education. And in public health service also already discussed. We can see in a health budget only 2.26% was given in 2022-23. Even less than 2021-22 budget. That was 3.45% out of the total budget of India. And finally, in the revised estimate, it was 2.33% only. And this year, 2022-23, it is 2.26% only. So you can understand what is the attitude of the government about our public health, healthcare services, healthcare delivery system. So they are trying to totally trampling down or making it upside down the recommendations of the Board committee, not keeping a minimum basic MBBS qualified doctor in the lowest level of the health system. They are trying to include PHO by nurses. What they tried to create by DCMS course of 3.5 years course, half-baked medical doctor. Even in Bengal and some other states, this informal healthcare providers, non-registered medical practitioners, they are being promoted not as a health worker. We want them to be health workers, trained health workers, so that they really can help the people of the village sites, rural areas, under the guidance of the medical officers of the particular primary health center or block primary health center. But they are actually trying to replace the block medical health officer or the primary health center health officer or medical officers by those non-qualified, non-registered, common medical practitioners. In other terms, people call them as quacks. So what they are doing? Are they improving our health service or they are destroying it? And without increasing the health budget, without increasing the medical manpower, including medical teachers, including medical officers, nurses, technicians, pharmacists, other categories of health workers in our public health system, you can never improve health service. COVID or no COVID, or any other disease outbreak, it will vividly show the picture of our real health status and public healthcare system. Insurance can never replace or can never be an alternative of fundamental health right of the people. It has been said much before by father of public health in another sense, Dr. Norman Bethune, in this modern era, who said the function of medicine is greater than the maintenance of the doctor's positions. The security of the people's health is our primary duty. we are above professional privileges. So insurance, even in the country like US, where out of the world, most of the insurance covered health service are being run. Nobody is satisfied with that. With the hidden agenda of the insurance companies, people are frustrated, not getting their cover, and lots of people are against these insurance companies. You all know the picture made by the Michael Moore against the insurance health policy in USA, which vividly showed to the world what can be the fate of insurance. And in India, now the present regime of the government is doing it very vigorously, robustly, in one name or another. Ayushman Bharat, Swasth Sathi, RSBI earlier, or in other states also, in many names there are some insurance policies. But without keeping real importance, without allotting more money, engaging more manpower for our people, we can never improve our public health service, healthcare delivery system. What is being pursued by the government nowadays? And instead of MCI destroying it, what they have brought in the name of NMC, NMC is hellbound to do such kinds of medical educations for the present generation of students. In the name of competency-based medical education, they are actually destroying or finishing whatever minimum amount of human feelings, human touch with the patients, direct teachings of the important teachers, prominent teachers to their students. They will actually dissect all these things and they will try to bring some mechanical, some technical know-how, knowing degree holders devoid of human feelings and medical ethics and social responsibility. And there will be easy for the corporate sector to use them in their system as pawns. In government setup also nowadays, without providing proper facilities, infrastructures, even the most qualified and dedicated doctor who love their patients, who love people of this country, they are also being deprived of giving proper service. They are getting frustrated. So, in the same way, to make these things more unscientific, they are trying to bring this Charok oath instead of Hippocratic oath, to bring Khadi in the name of giving boost to the Khadi industry of the country by making obligatory or compulsory Khadi dresses for medical students. These are absolutely bad, and no government can give some dictums to the dress codes of any institutions, any category of students. India is a varied cultural country. All state cultures and everywhere is not same. Even health is still today remaining in the concurrent list. So with such authority, centralization of entire power, nobody has given the constitutional right to dictate all the federal structural states to do such, do not that. Nobody is empowered, but they are doing that things. And the autonomy of education, what they are doing also, cutting down also in general education through new education policy 2020, in medical education also, by totally destroying the democratic structures forming body through elections, not by selection, what has been already said, the autonomy of education and the institutional control, university control are totally taken up by the administrations of the center or by the state. That is definitely pathological for medical education, for medical health service, public health service. We cannot accept that. As even our national leaders like Mohandas Karamchand Gandhi told that education should reach to every people of the country like raindrops and sunshine, sun rays. Our freedom fighter Lala Rajpat Rai said, a country's responsibility, a country's motive can be examined by its policies for education and health of its people. Today, this NMC, this Indian knowledge system, this new health policy, this competency-based medical education, what they are trying to implement, Charoko, Sutros, all are inimical to public health system, to science, to people's health. So medical service center must be conscious about all these things and must combine medical students, junior doctors, all other categories of health personnel, medical teachers, researchers against these heinous policies of the government. And I hope and believe that medical service center is actually proceeding towards that, and for that reason they have arranged this medical webinar also to commemorate or to celebrate the Doctors' Day as a week all over the country. I sincerely believe this endeavor of medical service center will help boost the medical people who are still believing on medical ethics, trying to inculcate it and trying to deliver real health service for the people of India. Definitely will be enriched with such kinds of discussions and webinar. Thank you very much.
Thank you. Thank you very much, sir. It was a very inspiring and detailed speech by you. On behalf of Medical Service Center, we promise that we do our best, we try our best in building health movement across the country. We have raised very serious issues that are plaguing this country, and health of the people is at stake. And MSc will do its best, whatever it is there in its ability across the country, to build up a health movement and change the policies. So with this, we thank you for joining us and giving us a speech discussion. I now request if any of the speakers have anything to add to this overall very enlightening and inspiring discussion on the eve of Doctors' Day and MSc. To remind our viewers once again, MSc is observing a protest week starting from 25th June and ending with a program in Delhi on July 2nd. If any of the speakers wish to add or say some take-home message, I request them. After that, I request Dr. Anshuman Mitra, Senior Member of Medical Service Center, Secretary West Bengal, to propose vote of thanks. Dr. Sajal Senapati sir, Dr. Shamsundar. Sir, if there is anything to add to this oral discussion, you can please do.
Thank you very much.
Thank you very much. Actually, we have to build up all-out movement all over the country against such types of anti-people health policies and anti-people medical education policies, which has been elaborately discussed here. We have to fight against it. It is my take-home message. Thank you all.
Yes, I now request Dr. Anshuman Mitra to propose vote of thanks.
It has been a very illuminating session for all of us. Despite some technical glitches, we could analyze all our illuminated speakers. They analyzed the current steps through NMC, through corporate health, through insurance, how the total health and health system and medical education system is being converted to a commodity to be sold to the highest bidder, and all social responsibility, health, medical ethics is being washed down the drain. With our so encouraging panelists like Professor Mridul Daga, who was the former head of the Department of Medicine and Professor Director in Maulana Azad Medical College, is also one of the advisors of MSc. Dr. Sudhanshu Senapati, who has been a consultant pediatrician in Orissa, who has been conducting a serious study into the present policies in health and education system. And I'm sure he will be leading us a long way. Professor Shamsundar Dipti, who is Emeritus Professor from Government Medical College, Amritsar in Community Medicine. Sir has explained the attack on medical education and the crisis medical students are facing with the new steps, uncertain steps of NMC. Dr. Tarun Mandal, who is a Vice President at the national level and a former Member of Parliament and Parliament Standing Committee on Health and Family Welfare. He has analyzed the ethical crisis which is involved by these very dirty steps which have been taken by the sequential, consecutive central government, not only this government, but over the last few decades. And Dr. Sajal Bishwas, General Secretary of Service Doctors Forum, West Bengal, who is leading a very glaring movement against the attacks of administrative terrorism, against bureaucratic and other attacks on the medical professionals. So, with such leaders on the panel, I'm sure the effort which Medical Service Center wants to release by highlighting this year's Doctors' Day, 1st July, in this issue where the entire profession is at stake, where many people have pointed out the entire medical profession and the medical system is at stake. So, we would request all our very audience, many people, since it was still working time, many people were unable to come in live, but I am sure many more people will be visiting and following the discussion. So 25th June to 2nd July, where we plan to observe the week of Doctors' Day wherever in whatever form possible, with the demands of stop attacks and killing of doctors and healthcare professionals, government attack on medical education through anti-student obscurant policies of NMC and CBME, corporate bureaucratic conversion of health and medical education, and compulsory insurance. These issues we have highlighted in the Doctors' Day, 1st July 2022. So, we expect all our friends, all our those who have watched this webinar, and we'll be all further networking it all over the country. So please highlight this day not as just as a festival, not as a party, but as an issue to highlight the doctor-patient relationship and responsibility of the physician towards the people and of the government towards the people. So And on 3rd July evening at 3 p.m., we'll be having a national seminar at ND Tiwari Bhavan at Delhi ITO, near the Delhi ITO. ND Tiwari Bhavan will be having the national seminar on the concluding on 3rd July evening, 3 p.m. So, inviting all people, particularly those of North India, to join us, observe through the week and 1st July and on their own institutions, departments, areas, and try to join us on 3rd July on the national seminar at ND Tiwari Bhavan, New Delhi. Thank you all.
So thank you, Dr. Anshuman, and I thank all the speakers and all the our technical personnel, technical support we have given for organizing this national webinar on Facebook Live. As Dr. Anshuman said, I appeal all our viewers, our friends, colleagues who are in medical profession to watch this show if they have missed, and with the appeal that I request all of you to observe the protest week and strengthen MSc across the nation in building health movement. Thank you one and all. With this, we conclude this national webinar. Good night, everyone.